Your chest wall muscles, or pectoralis muscle, can play a significant role in the cleavage achievable after breast enhancement surgery. The pec muscles insert along the midline as demonstrated here. However, the point of insertion can vary from directly at the midline or far from the midline. Also, the skin along the cleavage area can be very tight and tethered to the chest bone, or very loose and thick. These factors can also impact on the cleavage after breast enhancement surgery. Typically, those women whose skin is very tight and tethered to the midline have pec muscles that are attached some distance from the midline. And those with very loose skin along the midline have their pec muscles attached closer to the midline. But this is not always the case. In this example, the muscles are attached some distance from the midline. So after implant placement, there is a high potential for having a wide gap along the cleavage area. In this situation, the surgeon must actively detach the pec muscles from the chest wall to allow for a wider base implant to achieve a tighter cleavage. Of course, for those women whose midline skin is tight and effectively tethered to the chest wall, there is a limit to how much of an improvement is technically possible. In contrast, here we have a situation where the muscles are attached very close to or at the midline. This is a situation where it is technically easier to achieve a deeper and closer cleavage. However, the surgeon must be very careful to not be overzealous when detaching the muscle from the chest wall, as this can result in implants sitting too close together, with the central skin lifting off the midline, resulting in what's referred to as symastia, otherwise known as monoboob. The final matter for consideration is the thickness of the pec muscles and the width of attachment to the chest wall. A thick pec muscle with a broad attachment to the chest wall can make achieving a tighter cleavage very difficult. The surgeon must at least partially detach the muscle from the chest wall to allow the implants to sit closer to the midline and thus achieve a tighter cleavage.